Ever since the One Care scheme came into limelight, many citizens were caught off guard with its plan to deduct a percentage from individual salaries to the possible capping of doctor visits.
It is still too early to implement anything. I think it's, from what I know, there's a lot of talk about it, a lot of disagreements, a lot of people are against it.
The government should be more transparent with this whole issue, and they should have discussions with the public, with the doctors, whether we are for it or not.
Kalau I tak sakit, dia bayar balik ke memang dia simpan je, tak guna lah macam tu. Kalau tak guna duit tu ke mana?
While the main objection for Malaysians is the proposed salary deduction, the underlying sentiment is that they still don't know what One Care is all about, or why is there a need for healthcare reform. Dr. Mary Cardosa of the Malaysian Medical Association, or MMA, helps clarify about the One Care scheme in general.
Well, we have been informed One Care is the name for the restructured healthcare system, basically, for the reform, of the Malaysian healthcare system. Some people say that there is no need for healthcare reform, but I think that there's always a need for change. And if you look at our healthcare system, there are problems with it. It does work in some places, in some areas, and we have got a very strong primary care and public health, and we have good health indices, But overall, we have to look at, I agree with the argument where you have to look at sustainability and you have to look at equity and accessibility issues, and now one of the biggest problems actually is the imbalance between manpower resources and workload between the private and the public sector.
MMA is currently involved in the One Care Technical Working Group in drawing up the scheme's blueprint.
When we go there, we don't go there as government servants, you see, we go there representing the medical fraternity, So we try to look at it from a broader perspective. How is this going to affect the doctors? How is it going to affect the patients? Maybe we give a bit of a more grounded kind of and realistic kind of perspective in terms of practicality of implementation, possible problems, and so on and so forth.
There are 4 phases to the implementation of One Care. While the Health Ministry says that the scheme is still in its conceptual stage, some parties disagree. They believe that it's currently approaching phase 2. The financing mechanism that the Health Ministry proposes to sustain One Care has spruced even more opposing voices. This is on top of the announcement of making One Care compulsory to all Malaysians. One Care will be mostly public financed through a combination of a social health insurance or SHI, general taxation and co-payments. The SHI premiums is not solely borne by the employee, but also by the employer and the government. However, the percentage of the contribution and amount for co-payment is still under discussion.
Of course, people who are paying tax now say they're going to pay double tax, But in theory, this system is also supposed to collect from the non-taxpayers, except the poor who cannot afford to pay. I hope that the co-payments would be in that range, 3 to 5 ringgit to 10 ringgit, something that is actually affordable. The patients actually, I heard, have the option of changing GPs. You have to register with the GP, and I don't know what time frame you can change it in. But it means that GPs will have to make sure that they provide quality service.
For some, the social health insurance seems like another competition for local private insurers. Insurance provider Aaron Gajendran says that due to sketchy details in One Care, insurance companies have opted to watch and wait.
One Care is good. It's just the timing of the plan. It doesn't jive with the masses right now because of the issue of cost. If, let's say, somebody doesn't make any claims throughout his productive years, then how? Does One Care pay back a certain rebate? Is there a cash back? That's not clear.
Nevertheless, critics of One Care argue that the scheme is unnecessary. Dr. Stephen Chow of the Federation of Private Medical Practitioners Association of Malaysia voices his concerns about the feasibility of One Care.
So our feeling is that fix what is broken. Okay? And what is broken in the public sector, of course, is wastage and underproductivity. Let's fix that. Okay? And if the private sector, the issue of over-servicing, failure of performance appraisals will also need to be fixed. Okay? And these are things that can be done with minimal cost, and implemented almost immediately because the tools are already there.
Apart from the Health Ministry stating that the new healthcare system is still undecided, the lack of information and public consultation is keeping citizens from warming up to its reform agenda. Dr. T. Jayabalan from consumer rights group Citizens Healthcare Coalition has rejected OneCare entirely.
There could be conjecture on our part. Why? Because there's been no transparency. If they had been open with us, they had been inclusive, then we can negotiate, we can talk, we can tell them what's wrong.
Whichever healthcare system that will be decided, the MMA concurs that a more transparent plan is needed to allay public fears.
It must be, everything must be totally transparent, right? How much money is collected every year? Huh? Who collects the money? Who did the money go to? How did you pay the money? You know, and we need to know things like performance of hospitals, performance of doctors. That all has to be in public domain now with internet and all. All this kind of information should go up on public domain. Of course, there will be privacy issues and so on and so forth. But there must be certain parameters that are put out in the public domain so that people can make decisions.
MMA welcomes the public to send their feedback and ideas through info@mma.org.my under the title Feedback on OneCare. The public can also send their feedback to the Health Ministry's official website. At this point in time, it remains to be seen if OneCare would be implemented or not. Regardless of the government's decision on which healthcare system to pursue, the best way forward may be for all relevant parties to engage more with the public.